Welcome to Medication Administration Training. Preparing for medical appointments. Observations of residents. Observation is essential to assist in making a diagnosis or in keeping track of an individual's progress. It gives purpose and direction to an individual's care. It aids others, such as doctors, therapists, or social workers, in their work with an individual or family. As support staff, taking note of a resident's condition and recording health notes is extremely important to assist with medical appointments. As you get to know residents you support and practice observation skills, there are 5 resources that can be used when observing people. Number 1, looking. Take note of any changes in the following: facial expressions, skin, body posture, person's immediate surroundings, i.e. ventilation or temperature, and their condition, i.e. lack of appetite, dehydration, lack of energy, etc. 2, listening is the most important half of the conversation. Purposeful listening during conversation is a means for gaining such information as coherence, disorientation, worries, fears, needs, and interests of the person. Number 3, smelling. Unusual odors are an index to circumstances, and they capture the attention of an alert caregiver. For example, the observation of a sweet odor on a person's breath might be a valuable aid to the physician. Talking. It is important to show acceptance towards the person. Keep in mind that how something is said or asked, tone of voice or language used, facial expressions, attention, etc., makes a difference in the way a person responds. Number 5, touching or feeling. Taking the pulse is a good example of observing through touch. Placing the hand on the brow detects fever or perspiration. During both, the sense of touch may locate abnormalities of the skin or scalp. The support staff's role is one of supplying accurate, specific information to the physician and other professionals. This is a vital role at all times, and particularly for new medication. Please note, all recordings should be made away from an individual's sight if possible. This helps prevent anxiety and worry, which might arise if the individual watched a caregiver make notations about them. All health observations, signs, or symptoms must be documented as a health note in ShareVision. Health notes must be reviewed prior to any medical appointment, and any concerns or questions must be documented in the appropriate section of the medical appointment summary prior to the appointment. The hard copy of the medical appointment summary must be placed in the medical information binder to ensure staff attending appointment has accurate information, questions to ask, and can document on this form. It is extremely important that any concerns are documented to ensure diligent follow-up. Staff must also complete an electronic medical appointment summary on ShareVision upon returning from an appointment. As support staff, we are a resident's advocate for ensuring medical professionals receive accurate information. Medications are prescribed by the resident's medical professional. However, the person administering the medication is responsible for his or her own actions. It is important that the person administering be well informed about each medication. Staff must ensure knowledge of all medications and the reason for each prescription. Understanding a resident's medication. To be well informed, support staff will need to know the reason the medication is prescribed, the side effects, these may or may not be harmful, the expected effect of the medication. For example, if a doctor prescribes metformin to regulate blood sugars, it is essential for staff attending the appointment to ask the expected effect of the medication on blood sugar. For example,
What range of blood sugar is intended when on the medication? Staff will need to know whether the medication can be taken with other medications the resident is currently on, whether the resident can take the medications the way it is prescribed, or whether certain foods or other medications will influence how the medication is absorbed. Important reminders for medical appointments. Medications can be administered for many different reasons. Ensure to understand why medications are prescribed. For example, antihistamines can be prescribed for allergies or anxiety. Seek clarification on any medication changes and ask the doctor to repeat if necessary. Staff attending medical appointments are responsible to receive, document, and communicate accurate information to the team, family, RM, etc. As well, document any follow-up necessary. Each resident has a medical information folder. As support staff, it is important to know the location of the medical information folder for each resident that you support. Staff attending a medical appointment must also ensure the following documents are in the medical information folder prior to attending an appointment. A medical appointment summary completed with questions to ask, any health notes or concerns. A current list of medications, emergency and family contact numbers, previous medical appointment summary for review or recent medication changes if applicable, blank copy of a medication change form, and an MCP card. If the doctor prescribes a new medication or changes any existing medications, a medication change form must be completed and placed in the medication administration record so staff completing medications can review the changes. Staff will also need to complete the med change section on the electronic medical appointment summary on ShareVision. Any documentation or data requested by the doctor or relevant documents must be also placed in the folder. Here is an example of a completed medication change form. Please note that the section checked in the example is decreased medication. The doctor decreased John Doe's risperidone 3 milligrams from twice a day to risperidone 3 milligrams once a day. When following up on medication changes on the MAR sheet, the pharmacy will send a new MAR sheet with the new prescription label starting on the date of the change, which in this example is March 5th. The old label will need to be discontinued. Here is an example of a medication change documented on a MAR sheet. The previous prescription label for risperidone 3 milligrams twice a day has been discontinued starting on March 5th, the date of the appointment. There has been a line drawn across to the end of the month beginning on the discontinuation date of March 5th. Ensure this is done for both administration times of 9 a.m. and 5 p.m. Note discontinued March 5th is written above the line. Below this label is the new prescription for risperidone 3 milligrams. Take one tab once a day. The start date is March 5th and a line is drawn to this date. It is important to note that even though the medication has the same name, a new label is required whenever there are any changes in medication label instructions. Staff are not able to write any changes on labels. There must be a clear start and end date on all new doctor's orders. This concludes the Medication Administration Refresher Training for Module 1. You will be required to complete a test at the end of this slideshow. This can be located on ShareVision in the training section.